Soumya. I'm Dr. Prabha, and your gynecologist Dr. Nina has referred you to me because she said that you went to her for low backache,
That's
and but she found that you were a little sad and upset, and she felt it was important for you to see me. Okay, so I'll just talk to you and ask you a few questions about how you're feeling in the last few weeks.
okay.
Okay, so tell me what made you go to the doctor.
From post, after delivery, I have two girl child. One is 6 months old. So after delivery, I have a lot of back pain. So I met doctor. So as well, I was not having a proper sleep.
Okay.
So I met doctor because of that.
Okay, so since when have you been having this sleep disturbance?
Sleep disturbance post delivery and even in the pregnancy sometimes I had.
Okay.
Yes.
And in addition to the sleep problem, I'm going to ask you a few questions about your mood. In the last 6 months or the last 3 months, how have you been finding your mood?
I find most of the time like I can't able to. Most of the time I feel sad about little things, and I feel tensed about the some of the little work at home also.
Okay.
I get tensed.
Okay.
So I'm not able to take care of my children also. Even though I try to be a good mom,
Yes.
but I find it little difficult to take care of my children because I have back pain and
Yeah.
I feel very tired at times.
Okay.
So
Okay. So, and all this has been going on for the last 6 months
yeah, more than that maybe
during your pregnancy
during
as
my
well.
pregnancy as well.
Okay. So, what you just told me was that you have not been sleeping very well, and you feel sad,
Yeah.
and you're not able to look after your children as well as you want to, though you try to be a good mom and you want to be a good mom.
Yeah.
Yeah. And you feel tired very easily.
Yeah, I feel very much tired.
You feel very tired. Do you also get irritable? Do you get angry?
Yeah, sometimes for little things on my children I
Get angry.
get angry.
Okay. Now you told me that all these problems also started during your pregnancy and
Yeah.
have become worse in the last 6 months after the baby is born.
Yeah, it has become worse after my baby is born.
Okay. Can you tell me something about your family, Soumya? Because I know that your doctor has told me that you stay at home,
Yeah.
look after the children. But what does your husband do?
My husband is a electrician. From past maybe when I was pregnant for the second one, he lost his job.
Okay. And is there anybody else who stays with you at
Yeah,
home?
my in-laws are there with me.
Okay. You're both your mother-in-law and
Mother-in-law and
father-in-law.
father-in-law are
Okay.
there.
So sometimes when people are feeling sad and are stressed out, like you said, you get tense. There may be things in the family which may be happening. So I'm just going to ask you a few questions about how are things in the family. So what is it like with your in-laws? How have things been?
My in-laws are very nice with me.
And their health, everything is all right.
Yeah, their health is fine. They look after the baby.
Okay, they help you with the
They help
childcare
me.
also.
Mm.
What about your husband?
My husband, he's also good.
Mm. But
But-
I can see that you're a little hesitant. Are there any
Yeah.
problems?
Yeah, sometimes he's a very short-tempered person. He loses angry very easily. He gets irritated on me sometimes.
Okay. And so what happens when he gets irritated, when he gets angry? What does he do?
He first scolds me. Then sometimes, there are incidents that he has hit me also.
Okay. So when he gets angry, he gets upset with you and he
Yeah.
hits you also. So there have been times that he's hit you.
Yeah, he's been.
Have you had any serious injuries because of this hitting?
I told you that he's lost his job when I was caring for the second one. In my 5th month, he was like, he almost pushed me. I had to admit to the hospital
Okay.
because I had a pain during the 5th month. So
Okay, so because he pushed you, you had to get admitted into
admitted
hospital?
into the hospital.
Okay, because they thought that it might have hurt the baby?
Hurt the baby and maybe problems for me also. So
Okay.
I had to be admitted in the hospital for some
Okay.
days.
But fortunately, it was
It
all
was
right, and
all
then
right,
the
yeah.
baby was okay.
Baby was fine. But post delivery, since it's a girl baby again, he wanted a male child.
Mm.
But again, it has become worse.
Okay.
So,
I can see that you've been going through a lot in the last few months, through your pregnancy also, and that
yeah,
must have been very hard
yeah,
as well.
that is.
Mm. Okay. Um, what have you done about it, in the sense, have you spoken to anybody about this? Have you
Mm,
shared your distress with anyone?
I have talked to my some of my friends. They are little supportive, but my in-laws are nil. Like they neither support nor discourage it.
Hmm.
So
So they don't say
they don't
anything.
say anything at all.
He
So
Do they have other children?
no, he's the only child.
He's the only son, the only child.
Only child.
Okay,
So
so they don't
they
try to
don't.
protect you or anything like that.
They doesn't say anything.
They don't say anything.
Because they are also afraid of him, so they might
Okay.
he might scold him, so something.
And these this anger outbursts and all in the last 6 months,
Yeah.
how often is it happening?
He sometimes drinks also.
Hmm.
Most of the times when he drinks, he hits me. Otherwise, also he hits me. So,
Okay. So when he drinks, he becomes more angry.
yeah, he
But
becomes
even
more
otherwise,
angry.
he hits you.
Yeah.
Okay. I can see that it's hard. Hmm? What about your parents? Have you spoken to them? Have you shared
They
with
live in
them?
a different place,
Hmm.
different town, so I can't speak often because he's taken my mobile phone also from past few days.
Okay. And what has made him take your mobile phone away?
He doesn't want me to communicate to them about all this, so he has taken my mobile phone also. So it's okay. I don't want to bother my parents also about them, all these issues. But my neighbors are there. They are little supportive when he hits me and the abuse is too much. Then they come intervene and ask him to stop. But once they are gone, it again starts.
Again starts. Yeah. I can see that you're being quite brave about all this, and it must be hard with two small children.
Yeah.
Has the older child, has she
Yeah.
ever seen all this?
Yeah, he has noticed. She has noticed all this in front of her. Once or twice it has happened.
Once or twice it has happened. So it must be affecting her as well, isn't
Yeah,
it?
that's true.
So, Soumya, the thing is that from what I understand, you've been quite upset and you have some symptoms of depression in the last few months. And it looks clearly it is related to the violence which is happening around you. Is there anything else that is bothering you other than this?
Other than this, no. He is a good person, but he sometimes does all this. So I don't want to even leave him also.
Mm. I understand your dilemma, and I know that he may be otherwise a good person, but obviously he has difficulty in managing his anger, and he has not been treating you very well, and he has pushed you so much so that in pregnancy you had a complication. So all that indicates that there is a problem there. Um, I'm also concerned about your safety in the family. You are saying that even though you live with in-laws, they really don't do anything to protect you, and your little one has been watching all these things also. But the good thing, I think, is that you have friends and neighbors who are there to support you. Have you ever had to leave home in the night when he got too abusive or angry or anything?
This time it has not happened.
But then you may have to think of a situation that if the violence becomes too much, then you may have to leave because your life may be a threat, or it might be just that you should not be facing this kind of violence. Nobody, no woman should actually be subject to this kind of violence. So it's not correct. So there might be situations where it can get more, and you might actually have to leave. So if you have to leave, let's say in the evening or the night, is there anywhere that you can go to?
I think maybe some of my friends can help me out with this.
Yeah. I think it's a good thing that you have those friends, and you should keep them informed about some of these things. I know that your phone has been taken away from you, but maybe meeting them during the day or trying to communicate with them and tell them what's going on, because somebody should know about it. Okay. What I will do is, for your low mood, as well as your pains and aches and the fact that you're very tired, I'll give you a prescription so that it may make you feel better. It's an antidepressant that I will give you. You told me that you have now stopped feeding your baby, so it's safe. And so that's one thing, that's one part of it. But that's not going to take all your problems away, isn't it? So what I'll also do is I'm giving you these brochures. Okay, there are two brochures here of different organizations, and one brochure is all about, you know, women who face violence and how to handle it. You can read these brochures here in the waiting hall if you don't want to take them home. That's up to you. Because some women don't want to take the brochures home, so you can read it. And we also have a social worker, so I'll refer you to her so you can talk to her, and she will give you several options. Because sometimes when you're going through so much, you're not able to think of alternatives. You have tried from your part, you know, you've tried to access help. You've, you know, talked to neighbors. There are people there to help you. It's important for you to take that help and to be, you know, safe. Safety is not just for yourself, it's also for your two little girls whom you love very much, isn't it? So take these brochures. I'll also give you a prescription for your you know, mood and your other symptoms. And it would be good if you can come back and meet me in 2 weeks time. We will reassess the situation. And you know, there are services in the hospital also which can help you in situations like this. Sometimes it might mean bringing him in for some help as well. If you think that, you know, he's going through some issues and, you know, he needs help, then we can do that. But we'll do all of that step by step. The most important thing is your safety and the fact that you should feel better. Okay, and you should not tolerate or just keep quiet about the violence, as you know, because it can be quite detrimental to your health, both your mental and physical health. Okay. So let's do that. Is there anything that you want to ask me?
Nothing.
So you know, I'm concerned about you and your health, so we'll be available. We'll, you know, provide resources, and we'll see how we can help you through. Sometimes it's not easy, you know, to get out of an abusive situation. You might have done things on your own to do that, but sometimes it's quite hard because there's society, there's family. I also think that maybe it's important for you to share this with your parents, because you have not done that till now. Because you feel they will worry unnecessarily, but somebody needs to know. In addition to your neighbors and friends, you choose who are the people who should know about it, who will be there to help you. Okay? All right? Okay, Soumya. Thank you.